many of those affected can get paralysis, and that is very concerning.
A growing concern in the U.S., enterovirus D68. The CDC announced an increase in the respiratory illness that is affecting children. At least one case has already been reported here in Michigan.
The child would have cough, congestion, maybe a little fever, just a regular cold. And then a few days later, they would have this weakness. If that occurs, I would definitely recommend immediate evaluation by the pediatrician.
The first outbreak was in 2014, and every 2 years since, the virus has seen an increase, with the exception of 2020 during the nationwide mask mandate. This year, the respiratory illness is on the rise again, and physicians tell us this is the time of year cases peak.
Just like there's a flu season, there's a season for this sort of infection as well. That's just because of the nature of the spread of the virus, where it comes from and how easily it spreads from person to person.
Though children who already have respiratory conditions such as asthma are more prone to catching it, any child exposed to it can get it.
You can sneeze and you can catch it like that. So respiratory droplets, that sort of thing can spread it. Just like a respiratory RSV is another example of that, or the common cold for that matter.
The CDC says only in severe cases will children experience paralysis, typically in the arms or legs. Parents are advised to keep their children's vaccines updated and encourage frequent hand washing. Reporting in Saginaw, Lanita Brooks, WNEM, TV5.
And health experts want to emphasize that while enterovirus D68 is linked to the condition, it's still considered rare.